She was a gynecologic oncologist, board-certified surgeon. The first physician to complete a 4-year combined research and clinical training program at MD Anderson Cancer Center, one of the world's premier cancer institutions. She saved women's lives, pioneered new surgical techniques, brought advanced technology to Texas. And in 2019, armed federal agents stormed her home and her clinic like she was running a drug cartel. The government said she was running a pill mill. A jury acquitted her on 3 of 4 charges, but the DOJ wasn't done. They're trying again. Dr. Barbara Doyle Marino didn't just become a doctor. She became exceptional. University of Cincinnati Medical School. She received the Alfred H. Bilstein Award for being the top student in obstetrics and gynecology. Residency at Mount Carmel Medical Center in Columbus, an Ohio State University affiliate program. But it was what came next that defined her career. MD Anderson Cancer Center in Houston, one of the most prestigious cancer treatment and research institutions in the world. Dr. Marino was the first physician to complete their 4-year program combining basic research with clinical training in gynecologic oncology. For years, she treated women with gynecologic cancers, ovarian cancer, cervical cancer, uterine cancer. The kinds of cancers that kill if not caught early, if not treated aggressively, if not treated by someone who knows what they're doing. Later, she expanded. She was the first to bring smart lipo laser body sculpting to Texas at Med Spa 21 in Vintage Park. She stayed on the cutting edge of medical technology, and eventually, she began treating patients with chronic pain. Women who came to her after gynecologic surgeries. Women suffering from conditions that caused debilitating pain. Women who had nowhere else to turn. That's when she became a target. The DEA had been watching. Prescription monitoring databases flagged her practice. She was prescribing opioids. Too many, the algorithm said. Too frequently. Statistical outlier. The Department of Justice announced charges in what they called a massive opioid diversion network. 23 million pills diverted, they claimed. And there was her name, charged with conspiracy to unlawfully distribute controlled substances through Angel's Clinica Familiar. But they didn't just send investigators to question her. They didn't send auditors to review her records. They sent SWAT, armed federal agents, tactical gear, weapons drawn. They stormed her home. They stormed her clinic. They terrorized her family, her husband, her children, like she was a violent criminal instead of a 60-year-old surgeon. They seized records, froze accounts, destroyed her practice, humiliated her publicly. She went from celebrated surgeon to accused drug dealer overnight. The government's theory: she was running a pill mill disguised as a pain clinic, profiting from addiction, contributing to the opioid epidemic. They had her prescribing records, a conspiracy case built on the foundation that any physician prescribing significant amounts of opioids must be a criminal. Dr. Marino fought back. She hired attorneys. She prepared for trial. She refused to plead guilty to crimes she hadn't committed. The government painted her as greedy, reckless, indifferent to patient welfare. They came with distribution charges and conspiracy allegations. Her defense told a different story. She was a pain specialist treating patients with legitimate medical needs, post-surgical pain, patients whose suffering was genuine. After weeks of testimony, the jury deliberated, and then they returned their verdict. Not guilty, not guilty, not guilty. 3 of 4 charges, acquitted, complete vindication on 3 counts. But there was a 4th charge, conspiracy. On that charge, the jury couldn't reach a unanimous decision. Hung jury. In most cases, prosecutors drop it. Time to move on. But not with Dr. Marino. The Department of Justice announced they would retry her, and they added 3 new charges. 1 charge became 4, and the trial judge prohibited her from working as a physician, forbidden from practicing medicine while awaiting retrial. No income, no practice, legal fees in the hundreds of thousands. After years of her life stolen, she would face a jury again. But she didn't stay silent. She joined with other women physicians targeted by the DEA and DOJ. Research shows minority physicians, Black, brown, immigrant, Jewish, are disproportionately targeted, more likely to face asset forfeiture and pretrial detention. Dr. Dahlia Kirkpatrick, Dr. Khadija Asghari, Alexis Roberts McMillian, the list goes on, and Dr. Barbara Marino, still fighting. Let's be clear. A jury heard everything and acquitted her on 3 of 4 counts. That's a jury saying the case was weak. So why the double down? Is that justice or persecution? This is a woman who dedicated her life to saving women from cancer, and the government sent SWAT teams to raid her home. She should still be healing. Instead, she's fighting for her freedom. Dr. Barbara Marino's case isn't over, but her message is clear. History will decide who was right. Learn more at unbedsidemanners.com.